The United States has a weird healthcare system, where some is paid for directly by the federal government, some indirectly by the states, and a significant portion through private health insurance from employment. There have been many talks to provide a form of universal healthcare coverage to all Americans, like Medicare for All, for example. This problem seems insurmountable to solve because passing a bill would require a massive amount of change all at once. Another possible solution would be to introduce the change more gradually and leverage the existing infrastructure that the country has already built for federal health insurance. One way is to lower the age of Medicare enrollment, which is 65 years old. If coverage started at age 60, then that would cover more Americans that were already preparing to collect their insurance benefits. After some time, continue to lower the enrollment age to 55, and then continue the process until you reach age 18, at which the program automatically applies to everyone. This would prevent a sudden shock to the system, allow people time to get used to the new procedures, allows the government budget to increase more linearly and gradually, and is less controversial than doing it all at once. The incremental budget increase of expanding the system from 65 plus to 60 plus might not be as opposed as doing it all at once. If you lower the age of enrollment by 2 years every year, you could reach age 18 in 24 years. While that seems like a far-off dream, you're prioritizing, on average, people that need healthcare coverage the most, older individuals that have paid into the system longer. And the United States has been trying to implement some form of insurance since the 1960s when Medicare and Medicaid was passed. The politicians at the time thought that this was just an intermediary step until coverage applied to all Americans. Well, it's been 60 years since 1960, and while there has been healthcare reform, it has been difficult to pass and causes a lot of uncertainty in the marketplace. If this idea was passed in 1960, it would have reached full coverage by 1984, ironically. And needless to say, if you are collecting on one insurance benefit from the government, you cannot collect on another. People on Medicaid will be transitioned to Medicare when they reach the age of enrollment. Same goes with people on TRICARE or federal employee insurance. Everything gets consolidated into one system over time. This plan changes healthcare over time and gives a clear picture of where things will go. It reduces bureaucracy when complete because nobody will be using Medicare or TRICARE anymore. And it utilizes the systems we've already built when Medicare was developed. This actually makes a lot of sense if your goal is to provide universal healthcare coverage. Since it's logical and reasonable, the federal government will never pass such a bill.